Security is paid off. I mean, the rest is the taxpayers taking care. At some point, we're going to have the conversation. We're going to means test all across the board that if you're wealthy, you're going to pay for your health care. You're going to pay. You don't need Social Security. You don't need Medicare. And it'll be means tested all the way down to percentage-wise, and it'll extend from the top to the bottom. I mean, isn't that the only way to really get a handle on this?
It's really about the only way that I see to get a path through to get this thing turned around. I mean, we're $16 trillion in debt, and we've got a lot of things going on that we've really got to hone in on and bring a little bit different perspective and not business as usual and think outside of the box, so to speak.
Dan brought up a very controversial thing this morning. We were talking about the Farm Bill and how at least the Senate looked into this whole issue, and their version is $23 billion cut from the last version. Dan has a belief that we should do the same thing with the U.S. military. I mean,
look, we want to go. The conservatives want to go every organization, top to bottom. We're going to examine them, where every dollar is, where it's spent. And I said, well, the biggest, most fraudulent, wasteful, government-run organization is the military. Why can't we transparently look at what they do?
Yeah, and a good point. There is some wasteful money going on there for sure. Last year there was $487 billion cut. There's sequestration, which is going to take another $500 billion out of Department of Defense in January. We're trying to slow some of that down because right now, I mean, if sequestration hits, what's going to happen is we're going to cut our military back to levels of 1940.
Can you explain what that is? What is sequestration?
Sequestration is where the super committee that came together, basically it was put together to try to force folks to go in and make the cuts and get it done and put things on the table that neither side would want to have happen. Well, they failed. So what's happened is the sequestration is set up to hit, which is going to be 50% of the cuts in the sequestration come from defense. And defense makes up less than 20% of our budget. So, one of the things that we've got our number one thing is to make sure that we can maintain the defense of the nation. But you know what? We don't need to be the super police all over the place. And that's so much waste, fraud, and abuse that goes on there. You're exactly right. I'll give you a prime example. There's a company locally here that makes simulators to teach folks how to drive a truck. Well, we currently pay $250,000 for those things. A company here locally sells them for $25,000. And our company, the only difference is that our company locally doesn't have nighttime, daytime vision. Well, who cares? It's going to have the same effect on the people. So it's things like that we've got to capture.
So when someone says, look, I think we can cut 10 to 15% from the military, they go, well, that's going to hurt our forces. I'm like, not if we really honestly look at all the waste and corruption. Some of the contracts that are out seem to go to the same people.
But there's a lot more protection. There's a lot more us versus them when it comes to military than it is in other groups, I think. Congressman Bobby Schilling is in our studio.
As a small business, I want to ask you this because I just saw it in the news that over 60% of small businesses actually like the Affordable Health Care Act. Now, there's got to be a lot of tweaking done, but they actually do like it. They just don't want it to go away. From your perspective as a small business, has it made things more affordable or easier or what?
Actually, the prices continue to go up on the small businesses. So, anytime when you're adding things onto a national plan, it's going to drive prices up. Whether it's free birth control, whether it's keeping kids on till age 26, things like that, it's going to have some increased costs. But what we've got to do is we've got to address the cost issue, which the Obamacare did not do, and that's one.
It's an insurance bill, it's a coverage bill, but not a true health care.
So, Congressman, how do we do that? That conversation doesn't seem to be one that anybody wants to have. Well, we all do. I mean, we all want to have it. But when it gets down to the players, the people who are in the healthcare industry, the people who are paying for the healthcare industry, that conversation seems to stop dead. How do we get it moving forward?
One of the things that we have to do, and I believe, and we're going to hear something probably next week from the Supreme Court, and the key thing here is to make sure that we address the cost issue in Congress and then get it over to the Senate. But I think the key thing here is to do it in an open, transparent fashion with both sides coming to the table and sharing ideas, allow for competition across state lines.
Well, we were talking the military story. You gave that anecdotal story about the simulator that we can buy for $25,000 here locally, but it somehow the military pays $250. I feel that happens to us all individually when it comes to medical care. Really, the XYZ exam over there is $4,000, but I can get it over here for $1,500. That doesn't seem the right way we should be doing it.
Yeah, a lot of folks suggest that when you go in for exams or whatever type of service you're going to have, is that it's posted up on the doctor's office.
Yeah.
So when you come
like
in,
McDonald's has the nutritional information up, or your restaurant. Yeah,
but the real question then is: should government write the rules and enforce it, or should government be the arbiter to get these people together and say, look, you either solve the problem or we will, but you know what's going on in the industry. Couldn't you get everyone together at the table and say, can you help clean this up because you have skin in the game? Instead of people in Washington who've never been a doctor, have never run a hospital, never run an insurance company, making rules for an industry that they don't know about.
That is the great point, because I believe that that's the only way it truly gets fixed, is bringing people in what I call the final 3 feet that are actually dealing with it, that know something about it.
That's a good phrase.
Because I was in the financial services and insurance business for years, and you can see a lot of things going on. The one thing that scares me is anytime the government runs something, it tends to get way out of control, and its original intent gets away from it.
Lost,
and I think the key here is that we have people coming in and sharing ideas how and coming together, whether it's Washington, the docs, across the board, because that's how we fix it. To have a bunch of bureaucrats in Washington D.C. come in and say this is going to be the way it is,
right,
though their intentions might be good, the outcome of what turns out is actually pretty darn scary. We had a doc that was actually billing. This is why we're trying to fix Medicare so quickly, is because we had a doctor that was actually billing for 6,000 patients per week. The government doesn't care to watch that stuff because it's not their money, it's our money, and they don't really go in and that's
Nobody
why
ever bothered to go, wait a minute.
Right, and that's why private sector is so important, because they're not going to allow things like that to happen.
What is the website for your campaign, sir?
Is reelectbobby.com.
Beautiful to see you. Thank you so much for the pizza. Best of luck on the campaign. We'll talk to you before that's all over. Obviously, we'll talk to you a number of times before then, but have a great weekend.
Yeah, and we're having a free barbecue at the ELM building from 5 to 7 on July the 13th, open to the public. Love to have folks there.
Beautiful. Thank you.